This podcast is brought to you by Finzero. Finzero pioneers solutions and services to the AEC and manufacturing industries to support net zero targets. Visit finzero.com to learn more about how organisations design, build and solve through digitalisation. From Finzero to you, welcome to our Think Future podcast series. Each week we'll share conversations with industry leaders from around the world to find out how they're thinking future. Subscribe to Finzero Think Future for access to more episodes, interviews and profiles. Jason Hartke is the Executive Vice President of External Affairs at the International World Building Institute based in Washington, D.C. Jason, you have a PhD in Public Policy and a Master's degree in Journalism and Mass Communication. You've served in the Clinton administration in the Office for Intergovernmental Affairs. You've led the US Department of Energy efforts to advance energy efficiency, spent nearly a decade as a senior executive for the US Green Building Council, and you are the former president for the Alliance to Save Energy. You've amassed great experience in the green building movement, but today you are working for the world building movement. Share with us a little about your transition.
Thanks, Anthea. No, it's a real honor to be on your show today. I've been really lucky as it relates to my career because I set out early on. I wanted to be very active in the sustainability space and that movement, and also find opportunities to use my skill and my talent and my training in advocacy and policy. And those were the two bubbles of the Venn diagram, if you will, that have guided my career. And I've done a little bit of it all. I had a great start in the Clinton administration, got to work with policymakers at all levels of government, did a lot of work, interestingly enough, with mayors and governors, and got to see policy making kind of being done at a local level. And the great thing about that is things move quite a bit quicker. So I had an affinity to that level of work, policy work. And then I had a chance to be part of the kind of the early sustainability movement by joining on with the U.S. Green Building Council in 2006. There were only about 60 or so employees. Things were just kind of clicking. We're just starting to see kind of the early stages of that hockey curve-like adoption and uptake. And I'm really proud of my time there because policy and the work that was being done by the federal government, by states, by cities was really driving adoption. In fact, when I started at U.S. Green Building Council, there were only about, maybe half a dozen or so green building policies. And that grew by the time I had left to over 400 cities and communities around the country. So saw tremendous progress there, but again, was illustrative of kind of what I wanted to do and how I wanted to grow the sustainability space, and did a lot of work in classic green building, understanding that our buildings have a huge impact on the environment, particularly as it relates to climate change. Did a stint as you mentioned, at the Department of Energy. I ran the commercial buildings program there, helping drive market transformation in the commercial building sector. Here in the United States, commercial buildings represent about a fifth of greenhouse gas emissions. I'm lucky to have worked with a lot of leaders across commercial buildings over the years. And then I ran an energy efficiency nonprofit called the Alliance to Save Energy. And they were really focused on what can we do at the federal government level to drive efficiency. The organization has been around for 40 years. It's done so many great things, but I was lured away, as you might say, kind of in this next journey that I've been on for the last 2+ years at the International Well Building Institute, to really think about buildings and what they can do for us to help protect, enhance, and promote our health. I think back in terms of at least my early training in sustainability, and they used to talk about sustainability in terms of the 3 Ps, right? People, planet, and prosperity. And I know that a lot of what we do is very much focused on how do we avert climate change, how do we make sure we're getting ready, more resilient to some of the changes we're already seeing. And those those efforts are paramount. They're hugely important. But at the same time, what coming over to the IWBI meant to me is a chance to really focus in on what we can do to focus a little bit more on people. And that was really, really attractive to me. And I've been in the building space by that time for almost 15 years, I think over 15 years. And I think, we sometimes can be a little bit climate myopic. And stepping back a little bit and thinking about what we were doing at IWBI and having a chance to kind of drive this new market transformation that was focused, the work that we do, the programs that we have are exclusively focused on human health, but they're in the context of the larger sustainability movement, locking arms with our green building, brothers and sisters, thinking about resilience, thinking about equity. So it's integrated, but we are trying to lift and renew that priority to people. So again, not as I think we were talking a little bit backstage, if you will, it's not always, your career is not always linear. But I really did have these guardrails up where I really was interested in thinking about advocacy and policy as a lever for driving change. And the space that I wanted to work in has always been sustainability. I think that the work we're doing, around the world together, is collective work to accelerate sustainability, is so critical to our future. So it's been an absolute passion every day. I don't think I've been less excited any day. Every day I get up and I feel like we're doing imperative work. I feel like there's always a sense of urgency. And I think that's important in what you do, finding that passion.
Sure is. And it sounds like the IWBI has a goal to drive market transformation, much like you did with green buildings. They talk about advancing their mission of people first places. What does that actually mean?
It's a great question. And very similar to USGBC, we are all about market transformation and, trying to drive this movement to transform health and well-being with this people first approach to buildings, organizations, and communities. And, if you step back a little bit, where that all, the genesis of this idea is really about the power of the social determinants of health. And I know you've probably talked to some other guests about the social determinants of health, but they are universally, we double down on what the research tells us about these social determinants and the impact it has on public health writ large. And it's interesting because I'm gonna say something that I think a lot of people don't realize, and they certainly it's not said enough. Our organization tries to say it kind of many times to make sure it breaks through. But our physical and social environments have a greater bearing on our state of health than our access to healthcare, our lifestyle and behaviors, and our genetics combined. So, I'll say that one more time. Our physical and social environments, i.e., all the places and spaces where we spend our time, they have a greater bearing on our state of health than our access to healthcare, our lifestyle and behaviors, and our genetics combined. And so that's what makes the built environment so important, right? Because we spend 90% of our lives inside a building. Dr. Joe Allen, who's with the Department of Public Health over there at Harvard, he says we're an indoor species at this point. We are inside a building more than some species of whales are underneath the water. I mean, just give you some context.
That's incredible.
It's incredible. So how, a building is designed, how it's constructed, how it's operated, how it's maintained can have such a profound impact on helping improve employee health and well-being, driving these improvements in productivity that I think we're all kind of grappling to achieve. And then how do we boost recruitment and retention? And then even think about performance more as, not just the building's performance in terms of, let's say, energy efficiency or reduction in GHG, but the human performance. And that's really kind of the work that we're doing day in and day out at IWBI.
So can you tell us a little bit about some of the initiatives being driven to accelerate the healthy building movement?
Absolutely. First and foremost, we we are looking at levers to drive this transformation. And I think we have some of our leadership, myself included, but our current president and CEO, Rachel Hodgson, our executive chairman, Rick Vedrizi, we all hail originally from the U.S. Green Building Council. So we know what it means to have a roadmap that helps direct the market to move towards what we think is leadership. And we've created that roadmap that was debuted back in 2014 called the Well Building Standard. And the Well Building Standard is exactly that. It's this market transformation tool that helps anyone across the market, any building typology, to demonstrate leadership in health and well-being. We've got 10 concepts: air, water, nourishment, light, movement, thermal comfort, sound, materials, mind, and community. And those concepts are not ripped out of the sky kind of in some haphazard way. These are all the areas of all the product of all the research and development that we've done, and tried to translate that research into practice and said, hey, what are the interventions in a building that can help promote, enhance, protect human health? And so everything that we do is backed by evidence, backed by the research, backed by the science across those 10 categories, again, to help advance and improve human health. And so the Well Building Standard is our principal tool for market transformation. This is probably the subsequent follow-up question here, Anthea. I'll jump to it, but where are we? And it's been an incredible journey over the last 2+ years of my time here at IWBI. When I started, as an organization, we were just hitting 500 million square feet of real estate around the world using the Well Building Standard, or some portion of its ecosystem. We've got these other adjacent ratings. We are now at over 3.4 billion square feet of real estate in 111 countries, a fifth of the Fortune 500. We've got kind of the market uptake and adoption graph on the front page of our website, and it looks like that hockey stick. And it's a little bit deja vu for me because, again, we saw that type of adoption and uptake in the green building sector, and we're seeing it again very much so in this healthy buildings movement.
Do you think much of that's been driven by the pandemic?
I think it is. I think we were seeing really rapid adoption before then. I think the drivers certainly are more pronounced. I think many of the things that folks were doing and why they were driving into the health and well-being space from a real estate standpoint, things like retention and recruitment that might have been nice to haves when the pandemic hit, absolutely converted to must-haves. So there has been the pandemic was certainly an accelerant. Obviously, there's been a tremendous amount of awareness building that the pandemic has brought. I mean, it's one of the silver linings that you can't bump into somebody who doesn't understand the importance of, let's say, indoor air quality and the air that we breathe and the air that we're all sharing inside a building, the importance of ventilation and our HVAC systems and what those air exchange rates are, right? I bumped into a fellow parent here, and we're talking about our school, and all of a sudden the parent was trying to school me on air exchange rates, and I think I know a little bit about that myself too. So that's been really, really good to have those points of connectivity that we're all making, and that understanding certainly has made, I think, healthy buildings not just a nice to have, but an absolute expectation. I often talk about, as folks are going back into the market, we think about this confidence gap, this health confidence gap. And I think, whether, you work for a Fortune 500 company or you work for a mom and pop business on Main Street, uh, employees want to know what you're doing to prioritize health. So health is front and center. I think it's been, as some called it in the early days, a paradigm shock. I think it certainly has been a concrete, enduring paradigm shift where health is something that we think about. I don't know if everybody always thinks about it from the healthy buildings context, but we are absolutely driving these solutions in the healthy buildings movement.
So I know on your website it talks about prevention, preparedness, resilience and recovery, and you've laid out research approaches and operational strategies to deliver these well solutions, as you call them. What do some of the solutions actually look like?
It's a great question. In the context of the pandemic, we initially put together, just to give you a little bit more context, we initially put together a task force on COVID-19. We reached out to our community. We didn't know exactly what, who would step forward. At the end of the day, we had over 600 experts from around the world step up to join us to think about what those solutions should look like in the context of mitigating COVID-19 or any future threat, really. But what are the most pertinent things that we could do? One of the products that emanated out of that was the Well Health Safety Rating. That was launched in the summer of 2020, and it's been embraced by the market as a series of strategies that can be taken on and demonstrated as it relates to the operations and maintenance of a building, including emergency planning. So how do we ensure that we are doing everything we can within the power of the building on indoor air quality and water management, water quality, emergency planning, cleanliness and sanitization? All of those things were actually components of the larger, more comprehensive well building strategy, but this became a distinct leadership mark in the context of the pandemic. Obviously, there are kind of more intensive interventions related to indoor quality that I think have taken root. How do you redesign HVAC systems? How are you optimizing for ventilation? Some of those solutions I think are a little bit, they're either more expensive and they're needed, but how do you offset some of those expenses is a second part of the question. What I think was interesting about the Well Health Safety Rating is it got companies engaged and gave them an on-ramp into what is the healthy building journey, right? We always say that in the sustainability space, it's about the journey, not the destination. And that's exactly what's happened. We're seeing companies who are enrolling their entire portfolios in the Well Health Safety Rating. JP Morgan Chase, the Yankees. We're seeing Lend-Lease, huge commercial building real estate portfolios jump in and then continue the journey all the way to the more comprehensive well building standard.
And they're increasingly including well-being in their ESG reporting, aren't they? So what seems to be driving that trend?
That's a great question. It's a really interesting one because the idea that investors are asking for metrics and indicators related to human and social capital and how that might impact the business is one that will never go unanswered again. It's interesting because right before the pandemic, there were a couple of these ESG arbiters, some of these organizations that were, I'll put it more diplomatically, they were either neglecting, some were outright dismissing the materiality of health. And that's really interesting because, months later, you have a pandemic and it's not only undeniable, but then it's it's universal. So it was, hitting and affecting everybody. And so one of the things that we've seen over the last several years is a convergence around, what the role that health and well-being plays in real estate as it relates to, transparency back to investors. And it's become a tremendous driver of well building, because those investors are looking for specific metrics and indicators, many of which you can find in well building, that then can be reported up all the way into your ESG or your CSR reports. What's interesting thing about that is that, companies spend 90% of their expenses are on people. So it's really, we are, the expenditure is there. How are you maximizing for productivity? How are you, it's kind of all the ROI components. How are you maximizing for, premium rents and lease up rates? How are you maximizing for, retention and recruitment? We've got a talent war going on right now. We've got a great resignation going on. How do we make that a great retention? So all of these factors that we look at in the well building standard speak to very definitive metrics, indicators, data points that will help companies boost their ESG scores, which is how it should be. And I think what we've done, and it's not, we're not there yet, but I think we've corrected quite a bit in the last 2 years as it relates to making sure that we have this virtuous feedback cycle where investors are looking for data that correlate with improved human and social capital, and then how does that help them make better decisions, but also how does it make the company better?
Absolutely.
So that's a really important thing, and that continues to be a driver in everything that's happening in the space.
And in terms of great places to work, there's an absolute convergence of the green building concept together now with the well building concept. And I think we talked initially when I met you recently about Sustainable and Well, which is the National University of Singapore's first purpose-built net zero building. And we talked about that demonstrating the achievement of both high efficiency as well as wellness. Can you share a little bit more about projects like that or about that project?
Sure. One of the things that I think is critical to the to kind of winning on sustainability is integration. And our executive chairman at IWBI, Rick Vedrizzi, was the founder of the U.S. Green Building Council back in 1993. He was the president and CEO of USGBC for about 15 years. It's who I worked for when I was there for my almost 10 years. And then and now. So while at USGBC and now while at IWBI, he's always said that sustainability is about two things: planetary health and human health. I think the way that he kind of captures the progression is that in the kind of the first phase of sustainability, a lot of the focus was on planetary health. And we were thinking about, what does a climate-friendly building look like? How do we drive energy efficiency? How do we reduce resources and better use our water resources? How do we reduce material waste? All those things. I think what we're seeing, and particularly with the rise of well buildings, is this second phase focused on human health. Second phase, but not separate. Again, planetary and human health are one and the same. And winning on a green building has to be married with winning on a healthy building. And so there's a lot of cross-pollination. There's a lot of a tremendous synergy. I said before that, whether it's the U.S. Green Building Council or other green building councils around the world, we have very strong relationships with those folks. We are in an effort, a very urgent effort to make sure that we are going as fast as we can together. We've got crosswalks as it relates to well and many of those leading green building programs around the world, which I'm very proud of. So it makes those types of projects as you're talking about in Singapore, you know, very easy to do at this stage. And so there is an opportunity to be, you know, just as ambitious and aggressive on climate solutions in real estate as it is on these healthy building solutions. And I think that's a great thing. I think that's where we need to go. I don't think we're done there though. So, you know, I've done a lot of work with, you know, at the center of thinking about buildings in terms of integration. Even when I was at the Department of Energy, where I mean, you talk about being siloed, we were just solely focused on energy efficiency. But you know, you could see the offshoots of connectivity back to indoor air quality, back to climate, back to resilience, and I think we need to make sure that we continue to move in that integrated fashion. So our buildings really are living up to the promises and the opportunities that they represent to help solve climate change, to help promote and enhance people's health, to make sure that we're more climate resilient. And this one is a little bit emerging and nascent, but the role of real estate as it relates to equity, diversity, equity, and inclusion. Those are really important opportunities for the real estate sector to lead. And we've been doing some work on that as well, that I'm excited about, as you know, it kind of on the horizon.
Are you looking for a digitalisation and net zero partner to help you achieve your goals? Join the thousands of AEC and manufacturing customers globally who have turned to Finzero to start their journey toward a net zero future. With 32 offices around the world, Finzero can connect you to the right technologies and workflow processes so you can maintain your competitive position and increase profitability. Finzero has an industry expert to help you navigate the best pathway forward wherever you are on your digitalisation and net zero journey. Visit finzero.com to find out more. So what is the evidence-based research behind the statement that healthier organisations outperform their peers?
You know, I think from the real estate standpoint, it goes back to some of the things that you'll hear that green buildings were able to do. Well buildings correlate as well with things like lease up rates, rent premiums, lease terms, and that's been much more of a connection point recently in the time of the pandemic and trying to bridge this health confidence gap, right? So if you're let's say, you know, you're getting ready to try to lease out some space in Washington, D.C., and you're able to say that the space you're leasing is well certified, that's a big deal right now in the market. So the market, I think, signal is very much aligned with where we're going in terms of driving, accelerating human health. But I think the one of the issues that doesn't always play out as much kind of when you drill in at the real estate level and you have to kind of zoom out to the organizational level, and that's productivity. Productivity is in many respects like the holy grail. If you can improve productivity by modest percentages, you can have a enormous effect on a company, and you know, driving revenue and everything else. So, you know, we've seen those studies come up. They're obviously more difficult to do because you really have to, it's harder to get into kind of more experiment style research. So you have to kind of think across multi variables, but we are seeing it. I mentioned Joe Allen earlier. He's done some really important work as it relates to the impacts that indoor air quality, improved indoor air quality has on cognitive ability. So they're dubbed the CogX effect, that if you're improving indoor air quality, ventilation, your CO2 levels are down. You can make sure that you're actually helping improve people do difficult tasks. That's an amazing piece of evidence that shows this connectivity back to not just the health and well-being of the people inside those buildings, but their ability to be productive. And I think there's something bigger at play. I mean, after 2 years of fighting a global pandemic, you know, we can't underestimate how important our mental health is.
Absolutely.
And you know, our state of mind, our happiness, those are important things. We're hearing now from some of our partners who are, you know, developers who are saying, you know, I don't see myself as just kind of leasing out a space. I see myself as, you know, helping retain and attract talent. I see myself as making sure that once those folks are inside our building, are performing at their best. And I think that ties back to this larger ROI conversation. There's the improved employee health and wellness. There are some synergies as it relates to utility savings and maintenance savings that are consonant with what you'll see on the green building side. Retention and recruitment is really, really big. I think retention in particular right now, especially since you're seeing, you know, a lot of folks move on. So those things have huge positive value in the research.
They sure do.
They're extremely compelling case when you actually look at the like net present value per employee or the net present value per square foot, and correlate that back to healthy building.
So just back on that conversation around the Great Resignation, and even, you know, coming out of the pandemic, there's definitely a global conversation going on now around workplaces of the future and how organisations can bring their workforces back together. What role do you see IWBI playing there specifically?
I think it's going to have a big role. I think we'll continue to see the market move in this direction for many of the reasons that we just outlined and discussed. I think the future of work and the return to office will probably look a little different. We're talking a lot about kind of this hybrid model. Flexibility is a term that I think is here to stay. You know, we know that employees, based on surveys from a whole host of different organizations, have shown that employees are happier. They feel better when they have some built-in flexibility. So and a lot of that's built into our system, right? We want to make sure that we're incentivizing that. I think that there's going to be a bigger role to play in terms of what does working from home look like, how we make sure that those same types of solutions and strategies and interventions can be deployed at home, that you're set up at an ergonomic space. You may have your standing desk both at home and at the office. And so we're not kind of going back and having kind of a space that's conducive to health and then one that's not. So those are absolutely issues that are being worked through. But it's something that is carrying over from the work that we're doing in well buildings and the healthy building space writ large. We're actually doing some really interesting work focused in on the residential sector as we speak. We put together this really rich group of this advisory group made up of experts and folks from the residential market, leading developers. And we're seeing how some of these same solutions can be deployed at the residential scale. And I think that's going to be very, very much important as we think about the hybrid model. The other thing that we talked about is for commercial real estate. I think, and this is not novel, somewhat hackneyed at this point, but this is not a nice to have anymore. This is a expectation. This is something that is needed. Health, well-being strategies, practices, best practices. These have to be deployed if we're going to help people get back to the office and feel confident about being back in the office. Honeywell did a study, a survey this year that showed that folks, 72% of folks are still worried about coming back to the office because of health concerns and worries about health. So we have some work to do. And I think that, again, what we offer at IWBI and but these are open book strategies. These are things that aren't trade secrets that folks can do right now to lead on making sure that those employees feel safe and that they know that their health is being prioritized when they come back to office.
I think that's a really good segue into what I was going to ask next, which is for organisations that are perhaps haven't yet made a start or are looking to advance and prioritise wellness across their business or their building. Where is the best place to start?
It's a great question. I think that one of the things that talked a lot about the launch of our well health safety rating and that program in the summer of 2020, that really has been an incredible onboarding program for organizations, whether you're doing a tenant fit out, and so you're doing maybe a small space inside a building, you're doing an entire portfolio. But that has been a really first step opportunity for folks because it's focused on operations and maintenance and those interventions that help make sure that you're and show accountability and leadership in air, in water quality, in emergency planning, in cleanliness and sanitization. Part of it is, and I've always said this in the building space, it's interesting. Real estate is cautious, and I, as these new strategies kind of come to the fore, we used to say, or even specific new technology, we used to say, everybody's first in line to be second, because going first is takes some risk, and again, largely risk averse sector, which I get. But these are now such proven strategies, proven technologies, evidence-based, and it's all about getting on the escalator. So, if you think about getting on that escalator, and if you have something that is opportunity for folks to take those first steps, like the well health safety rating, really pin down, lead by example on what you're doing in terms of your operations and maintenance, in terms of air quality, water quality, emergency planning, those things. That's a tremendous first step. And it's not long before you look around and you say, okay, now what next can I do? And so you're moving up the escalator. And I think that's where you can look to the entirety and the more comprehensive well building standard to go further and get higher up the escalator.
Yeah, I think that's a really clear on-ramp, and obviously there's just so much happening in your space. So when you think future for your industry, beyond all the things that you've talked about so far, what is it that has you most excited?
I'm going to parlay this answer to talk a little bit about policy and then really get into the answer. But I've been excited these last couple of years about the advocacy and policy space. I don't know if we had a chance to talk about it, Anthea, before the call, but there's been some really interesting work in the advocacy arena here in the United States, where folks from across the building industry and these building specific trade organizations and groups have come together to better focus on what healthy workplace policy could look like in the future. And so IWBI partnered up with groups like the American Institute of Architects, the ASHRAE organization, which represents all of the HVAC engineers here in the United States, the Building Owners and Managers Association, the Real Estate Roundtable, the Institute for for Facility Management Association, Green Seal, USGBC, the American Society of Interior Designers, all of these groups, plus another 30, 35 or so industry leaders from the private sector, have all teamed up to say, what can we do from a policy perspective, a federal policy perspective, to accelerate healthy workplaces? I think that's a tipping point, because it's really showing what's going on and how important this is to move faster. And lawmakers are looking at these opportunities very, very seriously. In the last year or so, we've seen half a dozen pieces of legislation that would financially incentivize many of the same prescriptions that we have in WELL and in the WELL Health Safety Rating for businesses across the country. So we're definitely kind of seeing this the policy space jump in a big way, thinking about healthy buildings, and again, accelerating healthy building strategies, knowing that there are some financial barriers for businesses across the country, particularly after 2 years of dealing with the pandemic and long stretches of hardship. So that's one thing. The other space, and this is kind of where I'll really dive into my more discrete answer. We've done a lot of work with cities over the years. We had a partnership announced a couple of years ago where we were working with the National League of Cities, a great organization. They represent 2,400 cities and towns across the country. I think their membership represents 200 million people here in the United States. And I always revel in the way that cities can move quickly to advance, solutions. They were a huge player in the green building movement. And we are in the throes of creating what we're calling a WELL City program. And it's very much focused on how cities can play a role, what levers do they have at their disposal to play a role to be a catalyst for healthy buildings in their community. How can they lead by example? So how are they doing it with their own public municipal buildings, their green spaces, their parks? How are they deploying these solutions that we know have tremendous public health benefit? And then how do they think of additional policies or programs that they can deploy in their communities that would, incent the private sector to do the same? And so that effort is underway. We recently announced a WELL City advisory made up of over 50 experts from around the world, very much focused on thinking this program through and what it would look like. We've got great partners like the National League of Cities, and already just from those early days of kind of drilling down, cities have come to us knocking on the door saying, hey, what can we do right now? What are the solutions that we can deploy right now? The city of Miami has really jumped in. The mayor there, Mayor Francis Suarez, has been a tremendous leader. He has jumped in a major way. He's also the current president of the U.S. Conference of Mayors, where he works very closely with mayors all across the country, and really wants to make sure he's doing everything he can in the city of Miami to walk the walk. And so they're deploying the WELL Health Safety Rating across a significant tranche of their public buildings. But it's that recurring conversation that we're having with other mayors in other cities. Austin has been deploying WELL buildings. Portland, Chicago has a policy that recognizes the WELL building standard. And so I'm really excited about kind of adding this ally that are our cities, not just here in the United States, but around the world, to join us in making sure that the benefits of healthy buildings are reaching all of those communities everywhere.
So, Jason, we've talked a little bit about cities. You mentioned to me earlier some work that's going on in the education space. What can you tell us about that?
Schools has been an area where very special to many of us at IWBI. I've done a lot of advocacy work in the school sector. I see it as one of the most important sectors where we have to move. It's a sector that should be first, right? And our current president and CEO, Rachel Hodgson, she was, before coming to IWBI, she was the founding director of the Center for Green Schools at USGBC. And so we've done some really important work over the years in the school space. This last year, we were kind of able to bring back a group that had put out this seminal report in 2016 called the State of Our Schools Report. And Rachel was still with the U.S. Green Building Council. I had just jumped over to the Department of Energy. But that first State of Our Schools report showed that the annual funding shortfall for school facilities in the United States was $46 billion a year. And for a variety of reasons, the report had not been done since 2016. And yet the United States was looking at a series of infrastructure investments. And our organization teamed up with the 21st Century School Fund to resuscitate it. And we relaunched and redid the effort over the course of 2021. And in September of 2021, we reintroduced the State of Our Schools report. And Thea, it's almost painful to talk about the findings. We found that 5 years later, we are now seeing a shortfall of infrastructure investment in school facilities of $85 billion every single year. Our schools still need so much more attention, especially if we want them to be leading on health and well-being, if we want them to be leading on climate and resilience. They should be the sector that is prioritized first, along with other priority sectors like healthcare and affordable housing and senior housing.
I think it's important we shine the light not just on the great results that are being achieved, but also where the work is still to be done. So thanks for sharing. I feel our conversation today has been really insightful. It's been great to develop understanding of the value of investing in human and social capital, and definitely to hear about the success that IWBI and indeed whole organisations and even cities are achieving in creating and building people first places. So Jason, thank you so much for coming on the program today, and we definitely look forward to having you back another time.
That sounds great. And thanks again, Anthea, for having me. This was a delight and pleasure. It's great to be talking with you.
This podcast was brought to you by Finzero. Finzero help the AEC and manufacturing industries keep pace with digital change and achieve their technological and sustainability leadership goals. Finzero is a company that cares about creating and building a better world. Together, we are working with industry and environmental experts, providing forums and platforms through our Finzero Think community to create conversations that matter to our future generations. We invite you to join in the conversation and participate in our Think community. Like and subscribe to Think Future to stay up to date with the latest innovations and conversations as we take AEC and manufacturing around the world closer to zero. You can download our podcasts at finzero.com or from your favourite podcast platform. From Finzero Think Future, thanks for listening.